Thank you. It's good to be here again. This is number 3. So do I have Kelly Brogan yet, or has she still got me? I got a ways to go. You have to come back to the Midwest a couple more times. All right, so I want to talk about being worth it as providers. Right? So we're all doing what we're doing. We're all seeing patients. We're all learning more because we believe what we provide to patients is worth it for them. It's worth it to us. It's worth it for our careers, for our families, for our own personal health. And most of the patients that see us believe that our care is worth it as well, from a prevention standpoint, from a less medication standpoint, from a I want to connect with a provider for the first time and spend time with them. So most of the people that come to see us value this and feel like it's worth it. But one of the criticisms of a direct pay practice is that it's for the wealthy and that it's really expensive. And so when I talk to patients in the community or potential patients in my community or my staff is talking to them on the phone, it's a value discussion. It's a talk about return on investment. And so it used to be a big talk about this long-term prevention, or over the course of several years, we can save money because it's X amount to see the doctor and to do the workup, and think about how much money you're going to save down the road. But the discussion can be, how much can I save you this afternoon? And so becoming a healthcare financial advisor, and that's how I bill myself in my office visit, saves patients hundreds to thousands of dollars day after day after day, because I've spent time to figure out how much things cost. So I want you to start to understand this and utilize this in your practice. It's an easy tool. It's not a fellowship. It's not a conference. It just takes a little bit of time and a little bit of understanding. So here's how to be worth it on the short term. Here are the truths. Doctors don't like to talk about money. We don't like those conversations. They're uncomfortable. The healthcare complex is completely cost blind. Nobody can tell a patient how much something costs. Nobody wants to talk about that, and nobody knows. But patients have growing sticker shock, and that will continue to get bigger and bigger. And so they're feeling the financial burden of healthcare. Conventional, functional, integrative, they're feeling that burden. This is a recent survey the Kaiser Family Foundation published, includes data from 2016. Premium costs are slowing. Great news, because high deductible plans are rising. So the out-of-pocket money is going up. Deductibles in 5 years have risen 49%. And for the first time in almost 30 years that they've done this survey, 51% of people with insurance have a deductible greater than $1,000. That will continue to go up because we want to keep premium growth down, but that's going to come at paying cash for services, at least for the first 1,000, but more likely the first 5 to 10,000. What an incredible opportunity to reach patients and to save them money at the point of care. We're seeing premiums rising at historically slow rates, which helps workers and employers alike, but it's made possible in part by the more rapid rise in deductibles that workers must pay. One chart shows just how devastating healthcare costs are for American families. And this was a survey this was a study that shows what happens after a major medical payment to families. And for the sake of time, you can see that everything goes down. Income goes down. Non-medical expenses go down. Liquid assets go down. What doesn't go down is revolving credit card balance for these families. 1 year later, that still rises. This is our opportunity. Prevent this significant medical event, but cost save on the small, common medical stuff. So here are the truths that we started with. We can control 2 of these, right? And it should have shifted to the top 2, because we can control the not talking about money and we can control the cost blindness. What we can't stop are patients feeling the financial burden. But now the new truths are, this is a huge opportunity for us as providers who want to see patients, who want patients to come into our office and see not just the long-term worth, but the short-term worth. So go learn how much things cost. Go find out the opportunities that you can save patients money. And so I've done this, And I continue to do this and find cost savings. So the MRI at the hospital is $2,000 to $3,000. But there's a private MRI place in Fort Wayne, Indiana, our town, that'll do it for $400 or $500. Cash. Seems simple. Procedures. Nobody can tell you in our town how much a colonoscopy is going to cost you or how much an EGD is going to cost you. But most of the patients who go have them done who have high deductibles, $5,000, $6,000. I haven't found any place local, but I send somebody up here in the Detroit area to a clinic up here, it's $1,500 cash. Biopsy, sedation, pathology, $1,500. You've saved them $3,500 to $4,500 right off the bat. Specialists. I took my son to an orthopedic surgeon who was out of network. We called the office before the appointment, do you have a cash rate? We sure do. If you pay $250 down, everything is 30% discounted. If the charge is less than $250, we give you back the difference. Got to have these conversations for yourself, but also for your patients. Labs is the big one that we're going to talk about here in a minute, specific to cardiology. Serve as that financial advisor. Learn how much things cost in your community and help patients save big money. Here is, I show this to patients day after day after day. These are hospital charges for a standard lab panel that we order. And I've put arrows on the ones that are specific to a cardiology workup. So a fasting lipid profile, an ultrasensitive C-reactive protein, a homocysteine level. I think I threw a CBC in there. So this is a conventional workup. This is going to end up being $1,400, $1,481. That's the hospital rate for those labs. Yeah, some insurances are going to discount that. Hers didn't, hers did some, but her out-of-pocket was still very significant. How about the consult to tell you everything looks good? Or the phone call from the MA that says it's all fine? How does that help anybody? That costs $400 to $800 for that consult because it's a specialist appointment. So your total visit cost in the conventional realm for that patient is $1,800. Now, if they come to my office and we have negotiated cash labs, that total cost of blood work that was $1,481, the exact data is $76.10. We charge a $50 administrative fee because my staff has to process that order. This patient's total lab cost is now $126.10. That's a savings, I took out the consult part, just in labs of $1,288.71. If you apply that money to the cost of my consults, that's over 4 hours spent with me. You don't need or want 4 hours spent with me, right? So we'll review this for an hour, and you get to go home with almost $1,000 in your pocket. So become a healthcare consumer. Seek out opportunities to offer things to patients that will save them money at the point of care. Be worth it in the short term as well as the long term. Thanks.